And we're going to be moving to pharmacy. Yes, yes, yes. Tom, obviously, everybody knows, is a host of the AI Shift on Healthcare Now Radio. Harry Travis is a nationally recognized expert speaker and thought leader on AI and digital and all things related to that. And he works very closely with the Academy of Managed Care Pharmacy, AMCP. Tom, Harry, looking forward to this conversation, and I will turn it over to you.
Awesome. Harry, good to see you.
Hi, Tom. Good to see you too.
Awesome. So, this session is about a practical look at how AI is beginning to impact the community pharmacy operations. The pharmacy, the one that everybody forgets about, but one of the most important legs of the stool, if you will, in terms of how do we deliver better care. So I improvised out of my script here, but the community pharmacy operations workflow and patient engagement, we just spoke about that a bit with Heidi. Community pharmacies are under enormous pressure right now. Staffing shortages, reimbursement challenges, rising patient expectations, and increasing competition from digital first models. Opening question: AI is being positioned as the answer to almost every operational challenge in healthcare right now. In community pharmacy specifically, where are you seeing real value versus hype?
Well, I think that AI can provide, we'll call it short-term productivity gains in all of the different types of community pharmacies that are out there. There's over 50,000 different community pharmacies in grocery stores, standalone, chain, independents, all around the country. So inside of any pharmacy, any community pharmacy operation, is a series of what everyone's referring now kind of generically in the AI world as repetitive cognitive tasks. And there are a lot of repetitive cognitive tasks in pharmacy operations. And as Mark Anderson, the big venture capitalist, said many years ago, software is eating the world. Remember that quote? Well, AI is eating cognitive repetitive tasks, or repetitive cognitive tasks, whatever order you want to put it in. And it depends on the level of cognition as to how fast AI is going to eat that task. But as it applies to community pharmacy, when you stand back in a drugstore and you look at what's going on in the pharmacy, and you can look at the technicians and the pharmacists, you can see that they're spending an inordinate amount of time looking at a screen. And that is generally some task to move data around to clear a prescription. More and more AI will do that. So the good news is it is going to free up time in a pharmacy from kind of the tyranny of the screen. Also, voice agents can also help with inbound call management. So, yeah, I do think that there will be significant productivity gains in the pharmacy. What we do at that time is the big question.
And what you do with that time is the big question. In the previous session, we talked about AI in the encounter and outside of the encounter. In the pharmacy, I'm thinking, yes, there's a huge operation that takes place, but generally, and you can disagree, generally the patient themselves are coming and want to ask questions to the pharmacist. So it's I would call that inside the clinical visit, in the analogy to the pharmacy. Do you see AI playing any role in that particular segment of the operation?
In the patient encounter, yeah, AI could play two roles. One, AI could increase the amount of time that the pharmacist is available for the patient, right? So it's going to free up time so the pharmacist can spend that time with the patient. On the other hand, AI could act as the intermediary We could have an avatar talking to the patient. So, there's going to be a balance as to AI is going to free up time for more human interaction, or is AI going to replace human interaction? And in some cases, maybe there is a role for that replacement, because as we know, not everybody can get to a pharmacy. They have their phone. They can get an interaction digitally or something like that.
So when we talk about the pharmacy operation and the use of AI, what do you think of the biggest misconceptions are relative to pharmacy operations and about AI today?
The biggest misconception would be that with respect to AI and pharmacy, the the the, the biggest misconception is going to be that there's going to be massive job replacement. I think there's the fear of AI replacing pharmacists. I'm not sure that is going to happen, but that's one. I think that the other misconception is that productivity is going to happen faster than we think. I think it's going to be a while for all of these tasks to be replaced. Ultimately, I think it will, but that's the one misconception.
So I agree with you on the AI, and I'm not a believer that it's going to replace jobs. It might do it in some other industries, but when healthcare has this to me is the fundamental problem. It's not the question of how do we get the value. The fundamental question in healthcare across all stakeholders is I have less doctors and nurses and
Right.
less pharmacists, frankly, to handle the growing older, sicker population. Right. So I got a growing market that needs more, that has a greater need, and I have less people to deliver it. AI is simply, in my opinion, something that fills that gap so that we can still deliver care where it needs to be delivered, and ultimately achieve the goals of value-based care. With that said, given the constraints that I alluded to
Right.
in the opening, do you think pharmacies, independent pharmacies specifically, can afford the implementation of AI?
Well, I think you have to look at pharmacy from two standpoints. One, there is the practice of pharmacy and there is the business of pharmacy. Not unlike many of the professions, medicine, nursing, whatever. Okay, so the practice of pharmacy, what a pharmacist can do, remember, is regulated by the states, by the boards of pharmacy. Okay. The business of pharmacy, what keeps a pharmacist in business, is driven by reimbursement, payers, and entities like that. So along comes AI, and AI creates, let's just make overly simple and say AI creates time. Okay. So now, one, the pharmacists need to be able to expand their services so that they could provide more primary care access for patients. But we need to adjust the regulations to allow them to do that. Not all states are as shall we say, liberal in their approach to the profession as some are. Idaho, for example, has implemented what is called full practice authority, where pharmacists can write prescriptions in Idaho, but they can't in Florida. Okay, so that's a practice that has been adjusted. Now, if you can do that, are you going to get paid for it? Okay, it's one thing to say, okay, I can do it legally from regulators, but are you going to get paid for it? Is the state Medicaid program going to pay for it? Is commercial payers going to pay for it? Are people going to pay cash for it? So we as a profession, kind of and as industry, need to work both sides of that equation. And we need to realize that, in my humble opinion, there are an awful lot of pharmacists and pharmacies that can provide primary care services to people who can't get them now. And so AI is real positive in that regard. If all of a sudden, wow, it frees us up from all these administrative tasks. Now pharmacists can practice at the top of their licenses. We need to get the boards to recognize that and open up the rule book, if you will. And we need to work with the payers to say, if you could have a hypertension clinic running out of a pharmacy, if you could have a weight loss clinic running out of a pharmacy, if you could have a smoking cessation clinic running out of a pharmacy, a lipid clinic running out of pharmacy, wouldn't that be good? Because you could get a lot of people into the system that you couldn't get action normally. Does that help?
Yeah, that helps. So that's increasing the scope of the business model, right?
Right.
Having other services incorporated into the business that ultimately drives traffic into the brick and mortar, if you will, minimally, and how does that enhance the revenue model to
Right.
make independent and community-based pharmacies more viable for sure. Now, with that in place, start us off here. I got limited funds. I got one AI initiative to implement. What would that be?
Yeah. That's that is the challenge right now of many pharmacy operations because, and I think you kind of talked a little bit about in your earlier session, there are so many single point solutions out there.
Hmm.
So the act of filling a prescription involves, roughly maybe 10 different steps, from just intaking the prescription to benefit verification to checking on drug interactions to engaging with the patient to investigating copay assistance. There are literally dozens of companies now that have been started in this great proliferation of AI companies, kind of aiming point solutions in each one of those steps. So if you're a pharmacy operator, you have got a lot of people knocking on your door right now with AI solutions, and you've got to triage them. To your question, okay, where do I go first with these AI solutions? Which one do I look at first? And I think generally people have a good sense, operators have a good sense of where's my worst choke point? Is it inbound calls? Is it triaging prescriptions between various technologies that I have to fill it? Is it benefit verification? Is it determining copay assistance? So there's not one size fits all. But the good news is there are enough solutions out there for practically every step in the process that if you have a reasonable good sense of your operation and where what's your choke point, what's the one thing that's slowing you down, go to that one and apply look at your vendors, look at your technology, and try to fix that one. Is it just freeing up your technicians so they don't have to answer the phone? Because, an abnormally high amount of calls into a pharmacy are generally pretty simple, like, is my prescription ready? What are your hours? When do you close?
Yeah.
And what's the status of my prescription? A good AI agent can now answer those questions.
Yeah, so I'm concerned about the community pharmacy. I really truly am because I think of it as an independent provider on equivalence, right? I remember when I first started out in health IT in the early 2000s, and we were deploying EHR systems. They really didn't have an IT organization. They really didn't
Right,
have strategists. They
right,
they
right.
they had to go on their own. They had to rely on an IPA, hypothetically. They had to go someplace else, or cousin Johnny,
Yep.
and truly, and to get that advice. Where does the pharmacist go? What resources does the
Yeah.
pharmacist have to say, hey, let's aggregate our resources and let's try and do this together as a bigger entity
Right.
versus an independent pharmacy?
Well, first, let's go back to your premise at the very beginning, and I'm glad that you say you're worried about independent pharmacies or pharmacies in general, because we do need more people worried about pharmacies. We do have this unfortunate phenomenon going on of calling pharmacy deserts. A lot of small towns, a lot of rural areas in America are losing their independent pharmacy. And and the drugstore, the corner drugstore, cannot be replaced by drone delivery. Although some people think it
What?
can. Yeah, there are too many other things going on that are good inside of a community drugstore that can be easily replaced with a mobile app and drone delivery or mail delivery. Yeah, sure, some of that stuff can happen, and it is convenient, and I give you that. But I think that we really need to look at the resource, the key healthcare resource that the drugstore plays, particularly in not just rural America, underserved areas of urban America. There are a lot of sections of cities where independent pharmacies are going under. And to your point, okay, if you're an independent operator, you don't have a big IT department. How do I deal with this? Okay,
Yeah.
you have to look to your association or your business alliances that you're part of. There are PSAOs, Pharmacy Services Administrative Organizations, that most independents belong to. There is the National Community Pharmacy Association that most independents belong to, that provides a lot of technical support to pharmacists. But just like any independent business in today's AI world, even myself as an independent consultant, it's like, okay, how do I get my arms around Claude Code and everything that's going on to improve my own individual productivity? I phone a friend. I'm like, okay, I've got to get 3 or 4 friends together and figure out how to do it. And that's just how pharmacies are doing it.
So at this point in this conversation, I think the position is that a pharmacist can't stand still. They can't continue to be who they are today. They have to shift with the tide, in the context of, if I just stay quote unquote a pharmacy, you might be at risk, long-term stability. So you have to bring in more services that will generate that traffic and create that engagement. And you have to deploy AI in certain areas where it makes sense to create that efficiency, so your staff, while nobody's going away, but so your staff can operate across the board, can operate at the top of their skill set, right? Whether that be the pharmacists themselves or the person behind the counter. They all have to, they all have greater headsets on, if you will, and can deliver much more meaningful efforts, but they're so bogged down in the transaction. That's what I'm trying to get to, is that right now pharmacists are more very transactional, prescription written, prescription filled.
Right, right.
And now they have been in some circumstances that really that go to, because the patient sees the pharmacist more than they see their provider. So I need
And,
guidance.
right.
So I'm just looking at how health IT in general, inclusive of AI, can transform that pharmacy into my first resort, if you will.
What AI can help there, and you've touched on an important kind of foundational aspect of kind of the pharmacy business, in that most pharmacy IT applications, essentially the operating system that runs the drugstore, is prescription centric. It's run on one prescription after another, as opposed to patient centric. Okay, there is not in the DNA of most pharmacy operating systems, it is not a CRM. It is not a customer relationship management system. It is a prescription management system. So if you have a patient with 8 prescriptions, okay, you've got 8 prescriptions, and you're looking at it from a prescription point of view, as opposed to which you should be looking at it as a polypharmacy patient. Here is a patient with lots of drugs, lots of issues, and we need to start from the patient point of view, not from the script point of view. AI coding, AI applications are allowing a lot of vendors to come online, kind of flipping the script, poor pun, on that, to give a more holistic patient view that then gives the pharmacist a lot more information in front of he or her to talk to the patient. It makes the whole conversation a lot more efficient.
Interesting.
And to your earlier point, we can't stand still. I gave a presentation to you mentioned the Academy of Managed Care Pharmacies, which is really doing a lot of stuff behind the scenes in terms of drug coverage and using AI to make that whole process more efficient and more effective. At one of my presentations to the Academy of Managed Care Pharmacy, I used the joke, how many therapists does it take to change a light bulb? And the answer is only one, but the light bulb's got to really want to change. We are all the light bulbs. We need to want to change. This is not something this is really a call to arms. AI is going to change everything, and people have got to accept the fact that there's a lot more work ahead of us. It's not like anybody has time. Oh, now you want me to spend 4 more hours every week learning AI? Yeah, I do. And you just got to figure out how to do it, because there could be some really good things down the road, but we've got to invest the time in it.
And that's where, that patient engagement strategy from a pharmacist perspective really comes into play. Sometimes I think that we don't, I can't see the audience, but I'm going to say I don't know if we necessarily have a bad health system. I think we have a lot of patients that don't follow, and I'm one of them, by the way, that don't follow the provider's direction
Right.
on prescriptions. As again, I always go back to refills and prescription compliance. It's a huge cost to the system. The fact that I could stand to lose 40 pounds, right? So, but I just had a Coke before this program. So, there's a lot of behavioral changes, to your point, that both the system can embrace as well as the consumer can embrace, and together I think that's where true transformation is going to come into play. That said, the one thing that I always believe is an inhibitor to growth and transformation is policy. So if you were the policy wonk, if you will, what policy or reimbursement changes needs to happen for AI enabled pharmacy care to truly scale?
The simple answer is a phrase: provider status. What most people don't understand is in the eyes of most payers, CMS down to commercial plans, a pharmacist is not a provider. A pharmacist cannot bill for their time. A pharmacist doesn't use a CPT code. They make their money on the markup on the drug. It's really a weird system if you think about it, and it creates all sorts of weird incentives. So from a policy standpoint, like I said earlier, one, we've got to get the regulations right so pharmacists can do certain things, and then two, we need to get provider status so that pharmacists can be paid for it. And the payers need to realize that increasing access in primary care is going to lower cost over time. Might increase it in the short term, like, okay, guess what? We found 1,000 more hypertensive patients that we're going to put on medication. That's going to raise costs today, but it's going to prevent maybe 100 strokes in 5 years. That's a good thing. I'm looking at one of the questions online about chronic comorbidities, things like diabetes, hypertension, and heart disease. Early stage can all be screened and managed by good pharmacists with primary care skills. Those are three. You think about smoking cessation and weight, you got a lot of good happening just on those areas.
No, I agree across the board with what you said. At the end of the day, if we are going to now engage more and discover more, patients start their path to behavioral change relative to medication compliance and care plan compliance. yeah, you're probably gonna see an increase in costs, right? 30% of scripts never filled. So yeah,
Right.
we're gonna see more prescriptions filled. But at the end of the day, are we gonna see less hospitalization? Because that's the flip side of the financial equation. Do you want to spend more on medication or spend more on 10 to 30% of all hospitalizations are based on medication non-compliance?
Ta
So
Taking your medicine is probably the best return on investment of any kind of medical intervention. You know, if we could just get everybody to take their meds, think of all of the good that we would do. And you were talking earlier about the pharmacies. You know, we know that everyone visits their drugstore about 5 times as often as they go to their doctor, or at least in some cases, it's 10 times more. All of those little connections with the pharmacist could be used to reinforce some good behavior, be it medication adherence, smoking cessation, weight loss, hypertension checks, you name it.
all right, so we have 4 minutes left. I have just a few more questions to go here.
Mhm.
So all of what was said, leverage AI to help transform that pharmacist and reimagine the delivery of care within that setting. What AI capabilities do you think are mature enough today to deploy now?
Voice, I think, I've seen plenty of successful voice implementations to just triage the calls going into the pharmacy. And I know a lot of people are, particularly independents, are very possessive and very protective of their brand. You know, they're calling me. They want to talk to me. No, they want to know when the store closes. That's really what they want. Okay, get over it. And uh, and the voice agents are good enough now that there can be branding in there. So that is one. Benefit verification, real-time benefit verification, some of the stuff that's being sponsored and assisted by the Academy of Managed Care Pharmacy in terms of real-time benefit checks and the codes in terms of prescription denial, all of that, I think, is ready for prime time and needs to be implemented more. So kudos to AMCP for that. Kudos to NCPA for helping independents identify things like voice and benefit verification tools.
So I have two more questions, and we have 3 minutes. So first question: 5 years from now,
Mhm.
what will surprise you most about how AI changed the role of the community pharmacy?
I hope AI will initiate a resurgence in independent drugstores. That we will see more independent, you know, if we could, a snapshot today of, okay, if I knew exactly how many independent drugstores were out there today, if in 5 years there were more than there are today, that we were able to reverse the declining trend, that would be a huge win for population health.
Interesting. Last question. Uh, one piece of advice for community pharmacy leaders trying to navigate AI right now, what would it be?
Don't go it alone.
Don't
Do
go.
not go it alone.
Hey, can you be more
Okay.
specific? I didn't understand what you said.
To find whoever it is, it's a national association, a state association, a business alliance. Do not try to do it on your own.
Yeah, I couldn't agree more. It's more so in the community, independent community space. Um, I couldn't agree with you more. Find a group of folks with subject matter expertise and capabilities and establish your confidence that whatever you
Hmm.
do, wherever you invest,
Hmm.
because the investment has got to go,
Right.
right? You don't have the bandwidth, if you will, elasticity of your investment to fail,
Hmm.
specifically in the community pharmacy space. So, with that, Harry, great conversation. Always good to talk to you. All the best. If I could ever be of service to you, please give me a call.
Likewise, right back at you. Thank you, Tom.
Awesome.